Let's be respectful.
And you are now tuned into My Skin is My Sin presents another episode of Intellectually Petty Radio. And today we have Jay, the Loveologist, in the building. She is the CEO of Empowered Sexual Wellness, a certified sexologist, a sex counselor, educator, and a researcher. We got Jay, the Loveologist. How you doing,
Thank
Queen?
you. Thank you for that introduction.
I've been working on my shit, trying to get better at it. Make it a little bit more
Yes.
epic. How's life? How's your family?
Life is great. Busy. I'm about to hit dissertation, so it's just getting busy, real busy.
Oh, that's like the PhD joint, right?
Yes, it
Dissertation.
is.
Wow. Shout out to you. That's dope.
Listen, thank you.
Yeah, what
Thank
you doing it
you.
on? What you gonna do it on?
My research is on sex. So, I'm studying sexual racism and how it impacts sexual shame and sexual satisfaction. So I'm saying that, racism in society impacts individuals' ability to have sexual pleasure and causes sexual shame.
Okay, how? I mean,
How? Well,
yes.
we have a lot of stereotypes. Black women have a lot of stereotypes. Black men
Hmm.
have a lot of stereotypes. And because of that, and particularly, especially women, sometimes they play this role, and sometimes that role can prevent them from having the sexual enjoyment and pleasure that they need and that they desire.
Okay. Ooh.
Ooh.
Um. So let me ask you this. Okay, and I know you corrected me on sex counselor. Break
Yeah.
that down for me so I won't make that mistake again.
Yeah. So, there's different sexuality professions. Like, this field is so large. There are doctors, there are clinicians, there's counselors and therapists and educators and coaches. Myself, I am a sex counselor, sex educator, and I'm also a sex coach. And all of those are different. So, a sex therapist is normally dealing with mental health
Hmm.
aspects of
Okay.
sexuality. Now, although my education is in mental health, so I could be a sex therapist, I don't want to limit who's able to access me. So
Hmm.
I'm a sex counselor, meaning that you don't have to have a mental health diagnosis often to see me. Although I do work with a lot of mental health professionals,
Hmm.
and they refer to me, you don't have to have a mental health diagnosis to see me. I'm also a sex educator, so that's just like lessons on how to do different practices and to get your groove on. Also do some sex coaching, which is really kind of talking about different like elements of being confident in, not just within sexuality, but also intimacy.
So are you like their coaching or are you like coaching from from afar?
No, well, I normally coach and do sex counseling virtually.
Okay.
But I do get a lot of referrals from like OBGYN offices and urology offices, and I'm more comfortable meeting with those particular people
Uh-huh.
because they're a direct referral from like a doctor versus just any random person.
So what's the biggest concern people have when they come to you?
Gosh, it's a lot. I get so many different things that people come to me about. Some people want to know how to achieve an orgasm, especially with women. There
Hmm.
is a deficit for women to have orgasms. Like, not a lot of women have had orgasms.
That
We've
sucks.
been taught that the penis is the way to have an orgasm, which is one way to have orgasm, but it's not the only way. And women, it's proven that women more so receive orgasms from clitoral stimulation. So if you don't know how to touch yourself, if you don't know how, clitoral stimulation works, then you're 9 times out of 10, you've never had an orgasm. So it's really teaching people about their bodies for the
Hmm.
first time because we just don't know. So I get a lot of referrals and a lot of counseling sessions about that. I get a lot of people who have been through trauma. A lot of people that are cancer patients that have lost their groove, or maybe having some sexual dysfunction due to prostate
Hmm.
concerns, or even people that have had like injuries such as paralysis that want to still have pleasure. I still work with them as well too.
Really? Like
Yeah.
I know in some instances, like if you a quadriplegic or paraplegic may still have some feeling, down in their Johnson, but generally speaking, they don't. It for whatever reason, you can get it up. They tell me, but they don't feel shit. Their partner does.
There are some people that still have a sensation.
Hmm.
It's definitely not what it was, but the sensation is still there, and a lot of times they just want to be able to please their partner. So being able to do that and utilize different probes, because there are probes that allow for stimulation as well too, to make sure that it stays hard. um, Being able to utilize cock rings for muscle stimulation to make sure that it stays hard as well too. Using some practices like that, and also just different ways. So if an erection is an issue,
Hmm.
so a lot of times I refer people to go get a thigh strap. A thigh strap on is so hidden for a lot of people. It's a
A
strap
who?
on you can actually tie onto your thigh, and individuals can ride it, and utilizing other toys as well too, and just thinking outside of the box of sex. Sometimes touching, utilizing some tantra as well too, touching
Mm.
and being. So I get a lot of different people that come to me that want different advice, and I give them different strategic ways of being when it comes to intimacy. Sometimes it doesn't involve sex, sometimes it involves touch.
Hmm. So men come to you too then.
Yeah, all genders. We have individuals that are, trans. We have people that are, gender non-binary, and all different genders come see me.
I'm not sure what the last one was. What is a gender
Gender
non-binary?
non-binary.
Yeah.
Yeah, that's individuals that are outside of the box. So we often look at gender as being a man and a woman. So individuals that don't fit within those particular categories.
Okay. That's never heard of that one before.
Yeah.
Um, so with men, is intimacy a big issue that you're hearing, or is it strictly just a functionality type of situation?
Think it's a little bit of both, but
Mm-hmm.
intimacy is a big concern. I work with a lot of men that are in their 50s and higher,
Mm-hmm.
that are beginning to have, maybe testosterone decreases, and
Mm-hmm.
because of that, they're not able to get as hard.
Mm-hmm.
Maybe some parts of their penis are getting harder than other parts, and
Mm-hmm.
sometimes it's hard to kind of to stay up. So I do refer to different types of methods for them to be able to, you know, keep it up and being able to have that stamina as well too. Sometimes that's also working with urology offices. Sometimes it's a
Mm-hmm.
clinical issue. So I work with urology offices to make sure that there's that clinical component as well too. Um, Now intimacy is different. There's sex and there's intimacy.
Right.
Intimacy is like the way that you're able to woo your partner, the way that beyond just sex, that you're able to make sure that your partner is fulfilled. And that is a big concern too with all genders, but in particularly men too, that have been told that the only way that they're valued sometimes is with their dick.
Yeah.
And that's not the case, especially when we start seeing individuals that are having erectile dysfunction, that are having maybe lower stamina. Sometimes they start feeling a little bad about themselves, or feeling like their manhood is not there. Honey, it's still intact, it's still popping. But there has to be other ways as well too that you consider as well when
Mm-hmm.
it comes to intimacy, and that's why they come to me.
Yeah, getting old sucks as a dude. It just does, And like last year, like I had a heart attack, and so we were scared thereafter for a while. If we do something, I'm gonna fuck around and die.
Mm.
Well, neither one of us wanted that to happen, but you eventually work through that shit. But like, yeah, getting old, man, and people don't understand it. sexually getting old can be frustrating.
It can be. I think any health concern is just very kind of mind blowing for people when it comes to intimacy and sex.
Hmm.
There's people that have hip replacement surgeries. If you have a hip replacement surgery, there's
Oh,
certain things that
you can't do.
you can't do anymore. Or if you want to do it, then you have to be creative using a sex pillow, a wedge, being
They got a
able to,
wedge.
yeah, utilize different ways of being able to be intimate. And that's why people come to me, because it's like, okay, you're not going to get this from your doctor. Your
Right.
doctor is going to be very strategic and say, well, you're going to have to take some pain medication, maybe go to a physical therapist. This is what you need to do. Then
Hmm.
they come to me and say, well, my client wants to be able to be intimate with their partner, and I don't know what to say, because in medical school they only teach about prevention. They
Right.
don't really teach about intimacy in medical school programs. So then they come to me and say, hey, what can I do to help them, or can
Okay.
you help
So,
them?
all right. So you get a couple,
Hmm.
just a scenario. Let's say they've been married like 20, 25 years and they have hit a rut.
Yeah.
What's the first thing you recommend for them to kind of get their groove back? Because I think every relationship goes through that at least once, if not more.
Yeah. I think a rut is so common, especially with long standing relationships. um but before that, I
Hmm.
always do, I call it a pleasure inventory. It's
Mm,
almost like a sexuality history, kind of assessment. So before I even start to recommend, I get to
mm,
know my clients, and I talk about, maybe what they've been through. If infidelity has recently been an issue, that
mm.
that's that can cause a rut in
Yeah.
trust. If there's some issue, maybe you have an older child at home that doesn't need to be at home, but they're having trouble finding a job, and that's caused some issues with intimacy. That can cause a rut. So, I don't often jump the gun
Hmm.
and offer suggestions until I do that inventory and actually understand why they're seeing me.
So why sex? What was it about sex that just this is gonna be your thing for life?
you know, that's such a good question. Um, Previously, I worked in a very respectable field,
Hmm.
and I think sex is actually very respectable. But people have their own views about this work. Some people think that this work is too risque. But then those same people come to me for advice and help in their relationships and within their own intimacy. But I used to be, a chief diversity officer. I used
Mm.
to primarily do a lot of the strategic initiatives for a lot of Fortune 500 companies as well too, doing their
Okay.
trainings. I still do trainings, so I do work with a company that does diversity trainings, and does strategic planning and initiatives and assessments and all of those things. So I still do that on the side, but recently I just did a flip into more so focusing on my passion, which is sexuality and intimacy work. And primarily because one of my passions is working with individuals to make sure that they have a happy and fulfilling life.
Hmm.
When I call myself a loveologist, it's not that, because it's not saying that I have all the answers when it comes to love and relationships. I don't. And if
Hmm.
anyone says that they do, they really are lying to you. All these, what's his name, Kevin Samuel dude that says that he has all the answers and likes to point out all the flaws of
I don't.
everybody else.
But you know what? I don't think that. And I'm not a fan of this cat. Don't get me wrong, but I don't think that he says he got all the answers. And they call him. It's not like he
They do.
calling. It's not like he calling nobody up and saying, So they at this point they know exactly what he is about.
They do. They do. But there is a decorum. There is a way that you can be able to build someone without tearing them down. And
Yeah,
I
but that
think
ain't
that
popular.
it's popular.
It's
He is
not. It's like
popular. That's how he gets
no, 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 no,
that's
no.
how he
He's
gets the
popular
attention.
because he talks so much shit to people. People want to see
Yeah.
other people get torn down.
Yeah. Me,
It,
I'm
it
just the
sucks.
opposite. I feel like you can build people up. I feel like We have enough in society as Black folks being able to tear each other down. Why should I contribute to the issues? That's
I
why
feel
I'm
you.
in this work. That is why sex is the work for me, because sex is such a topic that people don't want to talk about. It's something that they don't want to address, and at the end of the day, it has caused so much pain within people. But I'm wanting to
Yeah.
flip that script and say that it doesn't have to be an experience that is oppressive. It can be something that you reclaim about yourself. It's something that you can own. If you don't want to have sex, I work with people that are asexual and want to find ways to be intimate without sex. I can
With
help with
who?
that.
Like who they gonna be intimate with? Who is
They're
okay with that?
partners, you know? There are people that don't have sexual desire, but they still want to have
Really?
some intimacy. And I suggest Tantra. I suggest, utilizing sensory wheels and toys and other ways that don't require sexual activity.
So there are people that did something happen to them in their past, they traumatized or whatever, or they just
It's a
legitimately just
combination.
don't
I
like
mean,
sex.
yeah, it's a combination. I mean, everyone has their own story.
Hmm.
Everyone has their own way of being. For some
Hmm.
people, they've never had the urge, and it has nothing to do with trauma. For
Mm.
some people, they do have the urge. Hormones are something that we can't necessarily, sometimes we
Yeah.
can control it with medication. Sometimes, medically, our hormones are not. Um, in a normal range, or what people may say normal. That
Hmm.
does impact intimacy, but hormones also can be different from person to person. Really, there are people that have no desire for sex. There's some people that they've experienced it before and they're just
Hmm.
not enthused about it. And there's some people that are demisexual, demi, which means that maybe they like sexual intimacy, but they're very, very particular on who they give that
Oh,
sexual energy to. Like, they're very particular.
those are crazy people.
No, not crazy people. No, not crazy people. Those are just people that are discerning. They're discerning about what they want to give their sexual energy to.
What's a good number? Like, what should somebody, let's say at 35, what's an acceptable number of sexual partners by the time you hit 35?
There is no acceptable numbers of sexual partners.
Okay, so like there's not like 1,000 is not too much.
I am not one to police someone's body.
Oh,
There is no acceptable number for me.
okay. For you, let me ask you this though: is there like a ceiling for somebody you would be intimate with?
No.
Oh wow, yeah, 1,000 would be too much for me.
I have I have met people that are sex workers that have been with thousands of people that have had zero STDs and STI history. I have met people that have been with two people that have reoccurring STDs and STIs. Shouldn't we worry about health and wellness versus numbers?
Yeah, but the problem is that especially as a guy, you don't want to be that guy that marries the neighborhood hoe.
Mm,
You don't want to be that guy. And it's not even that you may really actually think she may be reformed, be a great person, she done moved on, but you feel some type of ways,
but
like you
men
got it.
can be neighborhood hosts.
It's not fair, it's not right, but it is.
That is so ass backwards.
Hey, like it's not fair. It is absolutely not right, but that is the way of the land as it stands today.
Well, my goal is to destroy that notion that that's the case, because listen, we are in a society where we should be more concerned with sexual health than numbers, because I'm telling you that there are people that have been in their numbers are low,
Hmm.
but they're constantly being exposed to STDs and STIs because their partners, unfortunately, who some are men, are neighborhood hoes.
Yeah. Yeah, although I will say I think women are catching up now. Like this
Mm,
generation is pretty bad.
I don't
You know,
know.
yeah, I
I
don't
don't
know.
know.
You know,
You have to give me some proof of that.
I don't have actual numbers on that one, just from what you see. Um,
Mm,
oh, and let me see. I looked at Maxim, and they had the top 10 questions about sex.
okay.
And the first two were basically about a woman orgasming.
Yeah.
Number one was where's the G spot. Number two is how to make a woman orgasm. Number three, and four, okay, I didn't expect these two. Can you get rid of herpes and genital warts? Uh, how to get a bigger penis manually was number six.
Mhm.
How how to measure one was number
Yeah.
seven. Really, that people actually
Yeah.
ask you that?
Yeah. All of those things. Um, I will say the other day was National Herpes Awareness Month, and that is a very common question that sexologists get is if it can be cured or how do you know if you have it? And I will say, and since we're talking about individuals and partners,
Hmm.
3 out of 4 people have genital herpes. So if you have been with 4 people, you have encountered it at least once, whether it was an active case or an inactive case.
Oh wow.
It is one of the most common STDs, which is so important for people to get tested and to know their bodies.
Wow,
Yes.
that's yeah, y'all single folks out there, do y'all thing, man. Go
Yeah.
get tested. Go find out.
Yeah. But
Uh,
the measurements, that's
mhm.
also a very big question we get. Sometimes
Really?
inappropriate. Sometimes I get a lot of dick pics in my inbox and people wanting me to say, is this a normal size? And a lot of times it's not even very erotic. They're not wanting to like hit on me. They really legitimately want to know if it's a normal size. They legitimately want to know if their
Wow.
size is comparable. And I will say the average size, based on statistics, the average size is around 5.5 inches. So I always do that. That is the average size. But for people that are not larger endowed, does not mean that they're not able to please their partners. There are people, there are people with larger penises that don't know how to use it, that want to wham bam, and not a lot of pleasure when it comes to that. So it's important to consider that. And I always let people know, like, society really puts a big emphasis on size,
Hmm.
but really being able to have the skills matters. It's the skills. And that's why people come to see me for some suggestions and for some support and to actually rid some of that shame as well too.
Yeah, man. Like it's no dude out there has had flawless performances his whole life if he makes it to 25. You've had a night or two where it was just not your night. You was off your game and you was embarrassed. And you just gotta learn to live with that. It's just gonna happen. Like nobody
It's
hits
going
a
to happen.
thousand.
Happens to
Yes.
women.
How?
Women, I think a lot of people think that, well, it's easy for women because they could just like lay back.
Yeah.
But we don't think of it sometimes that way. Sometimes we're very critical of our performance. If we've done this, if we've done this right, if we were able to, you know, how long it took for us to make our partners come, and how we've been able to do this, and we're very performance driven sometimes. So it's not just men. A lot of women are very self-conscious in the bedroom as well too about how they perform.
So how long before a woman starts getting worried whether she got trash box or not to make a guy come?
Women, whether women think, think about it or not, it is a concern that some women have.
Hmm.
um I don't think there is such thing as a trash box. um I think there are women that are unfamiliar with how to use their bodies.
I
Just
like
like
that.
there are men that, from society standpoint, they may
Hmm.
have like flawless size, like in society's standpoint, but
Hmm.
they may not be hitting it because they don't have the skills. Doesn't mean that it's trash, just means that they need to learn and take a step back and learn.
Hmm.
That education is so important.
Damn, what's the big brother? Damn, he does the comedy skits and shit. Oh, I cannot remember, but he had a skit about basically for the women that he knew he disappointed. He wanted a makeup round. Is that a thing?
A makeup round. I mean, I've heard it. I've heard it before. I've heard people have makeup rounds before. Um, sometimes people say sure. Some people say no. One time was enough. But
Wow, it's got to
yeah,
be pretty
I've heard
bad
it
if one
happen.
time was enough.
Yeah, sometimes people say one time is enough.
Oh, that's horrible. And I'm pretty sure that in your practice you deal with infidelity a lot. I think you touched on that a little bit. Um, how do the men handle it? Because I know like it happened to me once and I did not handle it well.
I mean, it's a complicated. It's so complicated because it depends on who kind of like the perpetrator is
Hmm.
of the infidelity. There are a lot of men that have a lot of shame about what they've done if they are the person that's cheated.
Hmm.
Um, there are a lot of men that shouldn't be in committed relationships.
The thing is though, women say they want honesty, but really don't want honesty.
There, I think no one. I think there, any gender has an issue with honesty when it comes to being in a relationship, because on the flip side,
Hmm.
I've seen other genders as well too, and women as well too. I mean, this is like a we can take gender off the table and really
Hmm.
make this really inclusive. Women also, there are some women and some trans women and trans men and all other genders that also have an issue with commitment, that should not be in committed relationships. They're not thinking of the fact that, well, maybe the way that I love, maybe the way that I seek energy is not congruent to a monogamous relationship.
Hmm.
I know me. I'm not a monogamous person. I am very much polyamorous. And although I respect
Hmm.
monogamy,
Hmm.
I support it within my clients. Me personally, I'm able to seek energy from other people, not just sexually, but emotional energy. But we know emotional is another aspect of relationship as well too, and I understand that. And that's what
Hmm.
also makes me polyamorous as well too.
Okay, so
Some
what
people
exactly is
are more polyamorous.
polyamorous?
Huh?
What exactly is polyamorous?
Yeah, so polyamory is different than open relationship.
Hmm.
Will Smith is and Jada Pinkett Smith, they're on the news a lot talking about the relationship. Jada cheated on him with
Right.
August Alsina.
She's just horrible, and he's an honest, standing citizen.
Well, well, uh, recently there was an article in Essence magazine
Hmm.
that Will Smith said this was something that they both agreed upon, that this was something within their views of a relationship that they both agree that would be great, is an open relationship. Both
Hmm.
of them took part in not being monogamous. Both of them. The issue with what Jada did, which makes it difficult for
Hmm.
open relationships, Jada did not tell Will. Open relationships require communication.
Yeah.
It requires it.
And,
That's
and,
the
and
issue.
oh boy
That
was
the only
they
issue with
kid's
that
friend
situation
too.
was that Jada did not tell Will.
Well, he was their kid's friend too. That was a little creepy.
Yes. Now polyamory is different.
Hmm.
Polyamory is everyone is intrinsically linked
Hmm.
in a relationship, and it's not about sex. It's not about just going off and doing your individual thing.
Hmm.
It's being able to connect yourself with multiple people that also they're connected with each other too. So you may hear of thruples, three people
Who?
in a relationship.
Okay.
That's a type of polyamorous relationship where all of them are in a relationship together. There's multiple forms of loving, and you're able to give your love to different people,
Oh
not
man.
just sexually, but in a relationship. It's like a legitimate form of relationship.
Okay, so what's the difference between that and polygamy? Just marriage?
Well, I think of polyamory as like
Mm-hmm.
the umbrella. Polygamy and polyandry
Mm-hmm.
is part of that. So
Okay.
polygamy is actually marrying, you
Right.
know, multiple women.
Right. And polyandry is the
Polyandry
woman
is
marrying multiple men,
woman,
right?
yeah, multiple
Okay.
men. But polyamory is more so just about the loving.
So y'all like it's my grandma would say shacking up.
Shacking up, shacking up, I think people think of shacking up as like living with each other. Now,
Mm-hmm.
some people, they do live with each other.
Mm-hmm.
But I think of it just like they're dating each other, in a relationship with each other.
Mm-hmm. Okay. I mean, you know what? Like my
Everyone's
thing
in a
is,
relationship with each other.
yeah, long as everybody is aware and on board, it's do what you want to do.
Yeah,
It's when you start, like you say, not, the lines of communication are shut down.
that's the issue. That tends to be the issue with open relationships and even
Hmm.
polyamorous relationships. They tend to sometimes fail due to communication
And
and trust.
also, let me ask you this: when people cheat, at least from what I've seen over the years, when a man cheats on a woman, it depends on who the woman is that he cheated with as to how she responds.
Yes.
Is that a fair assessment?
Yes.
What's worse, that she's way prettier than your current, or way uglier?
I think it depends on the person.
Uh-huh.
Um, some people, it's not even about that. Some people, it's about the emotional connection that
Hmm.
person was able to get with that person. Some people are able to forgive those kind of like flings.
Right.
You're out on an academic conference, you're out on a work conference, and this happened.
Yeah. You got a little
Some
too
people are
drunk.
like,
It's
okay,
the one
well,
time. Let's go.
don't let that happen again.
Right.
But now, if you calling her or calling him or calling them afterwards and meeting up with them for months and months and months,
Yeah, that's different.
it's different.
Yeah.
Yeah.
Yeah. You got a whole nother relationship now.
Yes.
And at that point you just using me for whatever convenience I offer.
Correct. Yeah.
Yeah.
That's when it gets. That's for a lot of people. That's when it gets really woundy.
Yeah. Ain't no coming back from that, to be quite honest.
It there can be. I'm so I'm very optimistic. There are ways that people can work through infidelity, but it takes both of them to understand. It takes both of them to do the work. Um, and at the end of the day, it may come to pass that one of them is not the monogamous type,
Right.
and then there has to be some give and take at that point. Either you're going to stay in the relationship and be part of this kind of new function and structure of this relationship that is maybe open or polyamorous,
Or you
or
got to do.
yeah, do what you got to do, cut your losses.
I'm not mad at that. Have you had to be the one to tell like a couple, hey, so and so is not it needs to not be with you?
I don't ever recommend
Hmm.
anything like that. um I never tell a couple what they should and should not do when it comes to their relationship being together or not.
You got to be thinking it though sometimes.
Yeah, I think, in a split second,
Right.
sometimes we do, but what is more important to me is that they're
Hmm.
able to formulate that opinion themselves.
Mm.
It's more powerful if they're able to get that control over their emotions and what they need and what they want and their
Hmm.
desires, and able to come up with that decision themselves.
Mm. Wow. Can they still, like, are they still able to be friends after they break up legitimately?
Sometimes some people are, um after some work.
Hmm.
um just personally, there's some, I'll tell you, in my early 20s, I was trying this monogamy thing. This is one of the things that taught me that I'm not really the monogamous type.
Hmm.
My early 20s, I hurt some feelings.
Oh.
I hurt some feelings. And I wasn't mature enough or even aware enough of different forms of relationships that I could consider,
Hmm.
that I didn't have to be in a monogamous relationship, that I didn't have to put myself in a space where I wasn't like happy. So I did hurt some feelings. Now there's some of them that they're still really wounded by it. Now there's other folks that we've after that we just struck up a really tight friendship, and we've been friends ever since for
Mm.
like 10 years.
Yo, I had somebody 20 years after we graduated high school inbox me, still pissed at me.
Oh.
That's fucking crazy. You need some help at that point.
No, you must have had a profound impact on them. That there must have been a lot of emotional investment. A
Mm.
lot.
There's a lot of misremembering. That's what it was. Like I wasn't the shitty one in the situation. However, but how do you respond to something like that? I was not trying to be offensive or anything like that. I got a whole nother situation that's decades ago, and for whatever reason, this particular Tuesday, you upset with me out the blue.
I don't think it's out the blue. I probably it's something that they've always wanted to say, but now empowered to say it. And
So fuck
pain.
up my day for their empowerment.
Yeah,
Oh wow, man.
pain festers. At that point in time in a particular person's
Yeah,
life,
yeah.
you don't know what that could have triggered within them.
Mm,
You know,
yeah, you got a
and
point.
you just don't know, and it could trigger an insecurity that's hard for people to get past. Things that I even had to atone for, especially in my early 20s and
Mhm,
in my 20s as well too, of how I've made some missteps in relationships that I've had to take a step back and say, wow, there are things that I needed to do to heal before I actually jumped into a relationship, or things that, yeah, people have hurt me.
mhm.
And I had to think differently and say, hey, they were in a different space in their life. They were in a space in their life that they didn't have healing, and had to
Wow.
come to terms with that. So sometimes
Mm,
people, they move around healing and grief differently.
yeah, yeah. And people underestimate breaking up with somebody you've been with for a long time. It's a
Yes.
fucking death.
Yep.
Not everybody recovers the same way. Have you
No.
called somebody like up after a couple of years and been like, you know what, my bad for X, Y, and Z, but I was fucked up what I did.
Yeah. I've done that. Sometimes it's well received, sometimes it's not well received, but at the end of the day, yeah, at the end of the day, it's like, you know the apology is not necessarily for, although it is for them, it's also for yourself as well too, so you're able to move forward to become, hopefully to become a better human.
And see, that's the thing with me is like for me, it's like you really are only doing this for yourself. You're not really apologizing for my benefit. You have reached a certain space where you're more enlightened and want to absolve yourself of shit that's fucked up. So somebody calling me years after, yeah, I'm probably gonna bang on you.
Yeah, a lot of times it is absolving themselves from what has been circulating in their head.
Hmm.
Yeah.
You know, although I've been on both sides of that coin, so
Yeah.
it's different when you eating the humble pie. Shit
It
tastes
is.
completely different. If people want to get in contact with you, how do they do that?
There's so many different ways. They can go to my company website, which is the Center for Empowered Sexual Wellness. That is the THE cesw.com. Or they can find me on social media. On Instagram, it's at J the Loveologist. That's THALOVEOLOGIST. So that is my personal Instagram. You can also find me on my company Instagram at Empowered Sexual Wellness and on Facebook.
Okay,
Yeah.
and what exactly is empowered sexual wellness about?
Yeah. Um, it's a company that has been, it's a labor of love. I really put my heart and energy in creating this.
Hmm.
Almost makes me a little emotional. When it comes to sometimes the way that I've looked at success previously, I've
Hmm.
looked at, and I'm from Kentucky, a rural environment, conservative Kentucky, lived on a farm, lived with conservative grandparents that they didn't
Oh
even sleep in the same
wow,
bedroom together.
really?
No, they slept in separate beds. They were
So how they
sleeping.
get to have grandkids?
Yeah. Oh, they had a lot of kids. They had 12 kids,
Oh wow.
but they believed they just had a different belief
Hmm.
system. Um,
Hmm.
they just slept in separate beds. Doesn't mean that they didn't get it on though. But yeah, but when I initially when I first started doing like employment and working, I wanted something respectable. I
Hmm.
wanted something very professional, and
Yeah.
you know I worked in higher ed and still work with a lot of higher ed and respectable industries. But after a while, I realized my passion and purpose was to empower people to be sexually well. That sex is something that is natural. It's something that, especially if you're consenting
Hmm.
and if it's legal and safe and sane, that a lot of people experience. But unfortunately, we have a society and we have a world that sometimes sex is painful or taboo or has all these different views and attitudes. And I really created this empowered sexual wellness to be able to liberate people from all that shame, to be able to have fulfilling lives in relationships.
Hmm.
Yeah, I work with a lot of conservative religious folks. They're not able to have fulfilling relationships due to very conservative views that are impacting their intimacy. And,
Hmm.
I want to make sure that we liberate people from sexual shame so they can have fulfilling lives, not just with their partners, but within themselves.
Hmm.
And I think they deserve that. I think survivors of sexual trauma, survivors of domestic violence, survivors of racism, deserve to be able to have control over their bodies and their experiences and their pleasure in a safe and sane and consensual way.
Is there anybody that you come across that you turned away because it was just too creepy?
Yeah, several times, many times, um, and not necessarily in a turn away sense,
Hmm.
like not still providing them services. I'm a mom,
Right.
and there is also just a very strong boundary that I don't work with clients that have child fetishes,
Hmm.
or maybe some pedophilic tendencies.
I can understand that.
That's just my own boundary. So I have a lot of sexologists and clinicians that will work with those particular subsets of individuals. Just within myself, one of the reasons why I am a sex counselor versus a
Hmm.
sex therapist. Um, Individuals that may have those forms of that may be oppressive
Hmm.
or may lack boundaries, definitely see a sex therapist. They intertwine that mental health aspect.
So, is a
um,
sex therapist able to prescribe actual medication?
a lot of times they are,
Okay.
in conjunction with like a physician assistant
Hmm.
or an MD or a psychiatrist that
Okay,
will
got you.
help. But they could definitely support that. A lot of them are licensed practicing counselors,
Okay.
so they're able to work with clients
Wow.
with that.
Yeah, I definitely couldn't do that one. No, bro. I feel you 1,000% on that. That's just And even though those people are trying to help and do a service, like you can't unhear shit that you hear.
Yeah, there's certain, everyone has their own professional boundaries.
Mm-hmm.
Even therapists, they have their own professional boundaries that they may not be able to ethically see. Maybe it hits too close to home for them in their own trauma. And they
Mm-hmm.
want to be able to provide someone with the best care possible. Me, even with people that are maybe pedophiles, or
Mm-hmm.
maybe have some tendencies towards that, does not mean that they don't deserve some level of care. We want them to get help. We don't want to turn them away, totally. So what I do is I still work with them to try to figure out if I could find a clinician in their area.
Okay. All right. I mean, I'm not gonna say what I think should happen. That's a whole nother show. Actually, it would just be a quick show. But I know I only had an hour. I think our hour is just about up there, Queen. I don't want to take too much of your time. This has been dope, though. I really enjoyed the conversation.
This has been dope, and
Yeah, I learned some
just
shit too.
huh?
I learned some shit.
I'm glad you learned some shit. That's the goal. That
It
is the
helps.
goal. And
Yes.
imagine if we had like, listen, if we had like 2 hours together,
Yeah,
we
we
would
might
be
have to work on
we
that.
would be learning some deep shit.
Yeah,
Because
we
I
might
mean,
have to work
we
on
still
that.
haven't talked about BDSM.
I mean,
We
what's
haven't
that?
talked about adult baby diaper play and some other fetishes.
Okay, wait. Hold on. We got like 9 more minutes. Adult baby diaper play. What
Yes.
the fuck?
ABDP.
So they got initials. Oh boy. I'm sorry. For those people that so it's people that like to wear diapers. Do they
Yeah,
use the diapers?
there are people that is their fetish, that they enjoy it. They enjoy being taken care of. So they may wear diapers. They may have a makeshift crib in their house, and their partners engage in that, or maybe they hire a sex worker to help to support it. But yeah, it's a very legitimate fetish, and if done right, it's safe and sane and consensual. That is so important. So it's not
Same.
anything that's like child fetish or anything along that line. Nothing non-consensual. It is really an adult that pretends to be a baby to be taken care of.
Yo, that's just wild.
There's
O-
medical play too, where
Okay,
there's
everything
people.
can't be sane though. Some things have to be insane.
There are
That's
things that are
close.
not sane, and things that aren't sane really are non-consensual.
Okay.
Non-consensual. Um, and even there's very strong boundaries when it comes to consent, like BDSM. There are individuals that
What is that?
are, and that's bondage, domination, sadism, masochism.
Oh,
That's,
that's that 50 Shades of
often
Grey
people
shit.
think of it as like rope play, being bound, being gagged, spanking. Um, that requires very proactive consent. You have to have great conversation with whom you're working with, and who you're engaging, your lifestyle partner, who you're actually
Yeah,
with. You
yeah.
can't just do that with just anybody.
Tell that to Rick James. Oh, rest in
Yep.
peace.
Yeah.
But yeah, he tried
Yeah. Did you watch that Rick
that.
James documentary on
I
Showtime?
didn't. I remember when he went to jail
Yeah.
and why he went.
Well, on Showtime, there's a documentary
Mhm.
about Rick James, where it talks about someone observed him being intimate with a woman, and he kept on whipping her with this belt, and this girl was crying, and since she wasn't saying no, he thought it was totally okay, and he kept on whipping her harder and harder and harder and harder.
Oh
That is not sane.
no,
Although someone does not have to say no for it to be not sane.
that was definitely not sane.
Is not sane. So
That is
that's
the
why it's so important to have proactive consent. That's why it's important for people to learn that, not just go by Pornhub or all these, you know, porn sites where people think of ideas and say, I'll do this. Learn, contact me, contact another kink professional as well too before you start engaging in activities that can have some risk.
and there. I mean, well, there's an argument as the sanity of someone wanting to be like beat with a paddle.
You know, pain can stimulate pleasure. If you've ever gotten a tattoo, me, I have a lot of tattoos. Um, Sometimes the tattoos can have an erotic sensation.
No, my shit just hurt.
Mine don't.
Okay.
It's different. It's different from person to person. Yeah,
I
it's different
guess
from
it
person to
is.
person.
That's you meet somebody, it's like, hey, come punch me in the eye.
Oh, now that's different. That's
Why?
different.
Why is that different than somebody with
It
a big
is.
ass
It
wooden
is.
board?
There are some people that like to engage in a little bit more rougher
Mhm.
of play. But at the end of the day, there are regions of your body that they strongly suggest for pleasure when it comes to sadism and masochism and bondage and domination. Your eyes
Okay.
are tend not to be that place.
So what are recommended dominatrix places?
Like regions of your body, it
Yeah, I'm
really
assuming your
depends.
ass,
Yeah, it
and
depends
maybe
on
your
the
legs or
instrument. Like
something,
if you're using, like, let's say a paddle,
right?
the ass, the thigh, so meatier parts of your body, the thighs. If you use a, uh let's say a whip, um, that could be different parts of your body. That could be your arms, that could be your thighs, that could be your butt.
Oh,
Um, there's also electroplay too, that are little probes that give off a little bit of like an electric sting, like a
oh,
um
wow.
that's great, especially on the skin, the outer skin layer. Not great internally, not supposed to do that internally. So yeah, there's different parts of your body that for different play. But that's why it's so important to be able to talk with a kink professional before you start engaging in risk
A
and
kink.
risky play, especially rope play. You have to get training for
There
that.
are
Don't just,
oh, there's training for this. Oh,
yeah, there's training. Look up
wow.
Hassan King. Hassan King. He provides training. He's a kink and fetish just master. So he does some
That
amazing training. He's actually about to do some trainings in Denver and Pittsburgh. So, um, so yeah.
what a weird what a unique thing to be trained in. Wow. Um yeah, that was just okay. I definitely appreciate the enlightenment, Queen. This has
Thank
been
you.
dope.
Thank you. And you know, I'm here. I'm here when you need me. I'm here when you need me. So if you
I
want to
got you.
chat soon again, and you have
I
some other just interesting topics, hey,
yes, yes.
out
We're
here.
gonna we're gonna have to chop it up a little bit more. On that note, y'all be safe out there. Strap up. If you say you with one person, be with that one person. If you are polyamorous, be upfront about it. Whatever the case is, and thank you to Jay, the loveologist.
Thanks, y'all. Thank you for the invite.
No doubt. Have a good one.
You too.